Alajuelita is basically compound, like 80% of the population in Alajuelita is compounded by people, by Nicaraguan illegal immigrants. Due to the problematic in Nicaragua, they are forced to look for a better place to live, so they move to Costa Rica. If we were not here, they will be forced to pay a lot of money. When we first got here, like 10 years ago, we used to have like 100 patients a day, and they were extremely sick. Thank God and thanks to this organization, we have been improving their health in here, and the number of patients we are like treating every day right now is around 25. And the rest of the patients are not coming here because they come like oftenly, but before they are sick.
I love the project. Since I come here, I come being a student here, and I get in love. I never leave. I have 10 years here. I think that is a really good possibility to provide access to the people that doesn't have. Most of the time, the kids that we treat or the teenagers start to live in a complicated situation in their lives, and is that they cross the limit of the educational level that the parents have. That this is something that in other communities or in other social conditions you usually cross the level of education of your parents when you be an adult. So when you crossing the limit of education of your parents, you feel that you are an adult and you need to be taking care of yourself. So sometimes the work that we do here is trying to provide the kids the tools and let them know that they probably have more tools than the parents and they need to be in charge of themselves. And this is a really important thing that we do here, because it's not necessarily the way that we see the treatment in other conditions with kids. But here, make like a change. If not, you say, okay, those are your mom and your dad. They are like this, and this is what we have. So what we can do with that, and let's try to find like a way in your life to be like the best as possible. In a way, I think that we change the stories of the generation. So when a person comes to a treatment, when a person be responsible or their own life, this is like a clean in the generation of this person and provides like a benefit, yes, for the future and for the other generations.
I guess like for me, like to be in here, it's completely different than to be in a hospital, okay? Because for example, to be in a hospital, you don't know like the patients exactly. You just see the patient and he have this and bye. Here it's different. Like the big challenge for you is to have a good relation patient-doctor, because if they trust you, you can help them more, you know. So for me, the big challenge is to be patient with them and to do a better relation every day with them, so they can like feel comfortable to be here and feel good to be here. It's better for us because they can help us with the things that we say, and we help them also. We try here to give primary care of attention. Okay, we are a primary care attention clinic, but there's a lot of things that we don't have that we need to have. So in the future, we will try to do more, for example, home visits that are very important for patients, for example, elderly people or patients with physical disabilities that cannot come. And we don't have like the opportunity to go to every home, okay, to give attention. So that's one thing that we will try to do in the future. Another thing that we are doing is to see more women, more patients like every day. For me, the patients more in risk in here is women, because they have a lot of kids, they don't have insurance, they never do, for example, pap smear mammographies. It's very expensive to do it outside, and they don't have insurance. So for me, are the patients more in risk in here in Alajuelita. So for in the future, I would like to have like a group of women that we always see, do the pap smear mammographies and everything. Also the home visits, and of course we want to grow.